Humans' health and well-being is key to a prosperous future. But the landscape is changing. Individuals are taking health back into their own hands, urging for transparency, more options, and less red tape. NEOM is creating a new, holistic health and well-being ecosystem that caters to all world citizens, where people, not hospitals, are at the center of the system and can live, thrive, and be heard. Supported by the latest medical advances with a focus on proactive prevention, not just treatment. The knowledge is there and the precedent has been set. Sweden is a leader in the telehealth space and uses a collaborative, patient-centric approach. South Korea offers high-quality universal healthcare backed by extensive research. And Singapore and Japan are home to those who live longest in the world. But it's all happening in isolation. Imagine what we can do together. NEOM will tackle some of the world's toughest health problems, pioneering a new standard of well-being, with a focus on pain management, muscular and skeletal diseases, and cancer, and a balanced approach to overall well-being, mind, body, and soul. Co-created with and personalized for the NEOM community, encompassing integrative care and complementary medicine, and at the forefront of research, telehealth, and digital solutions. NEOM is committed to livability, longevity, and quality of life. The future of health and well-being starts at NEOM.
Good morning, everybody, and welcome back to our second day. It was an amazing day. We've been talking about it all morning, and look forward for another opportunity. And this is Ghassan Abu Alfa from Sloan Catering, and we are greatly honored to welcome the C3 on this virtual platform. And what a great start to kind of, and first and foremost, to welcome His Excellency Dr. Mohamad Alabdulaali, the Assistant Minister to the Ministry of Health in Kingdom of Saudi Arabia. It's a great honor to welcome you on the virtual platform of C3 today, Your Excellency. I know it's a busy times for you with all the amazing work that I admit I follow every day in regard to your amazing control of the C3 of the COVID-19 during this event that's going on that led us to do the C3 virtually. But nonetheless, with all this, please, the floor is yours. Thank you very much for being here.
Thank you so much, and I'm honored and happy to be part of this forum, the Saudi American Healthcare and Investment Forum, and glad to participate with all of you in this very important share of knowledge and ideas and strengthening of the partnership between these two countries on different levels. And thank you for your comments on the activities that's taking place in the kingdom in regards to the response to COVID-19 and all the efforts hand in hand with the other countries and other organizations that are responsible to handle this international unique situation that we are passing through. But inshallah, we are going to pass it all successful and safe out of it, inshallah. I will start presenting, and I guess that the share is going to be from my side. So I will start sharing my slides. Just a minute. So the world today, as you know, is passing through a period of unprecedented change. But in Saudi Arabia, the change is feeding into a transformational move. The transformation is on the way, and the pandemic emerged while we are moving, and still we are continuing to move and to achieve our transformation. This transformation guided by our Saudi Vision 2030 and the national initiatives and programs that are with it. The National Transformation Program is one of these programs, as well as the health sector transformation program, which is just recently kicked off program, adding to what all the 2030 is going to implement and going to take us to, inshallah. I encourage you all to put aside any preconceived notions you may have about Saudi Arabia. Even what was true a year ago has likely changed. In short, the kingdom is on the move. We are opening up our economy, we are opening up our society, and we are welcoming the world in multiple areas, ranging from business investment to tourism. Already just 4 years since Saudi Vision 2030 was launched, we have implemented more than 400 investment-related improvements. The kingdom now ranks first globally in the business environment reforms, and it has moved into the top 40 globally on the starting commercial activity index, a big jump from the 141st place only a couple years ago. The pace and scale of change in Saudi Arabia can be seen in our emergence as truly digital kingdom. Commitment from the government can be seen in its $100 billion investment in technology and digital space, guided by a national strategy for digital transformation and the effective implementation of the e-government platform. We call it Abshir. Hundreds of government services are now available on that platform. With half of our population under 26 years of age, many Saudis are digitally or digital natives. There are more than 40 million mobile phone subscriptions in our country, while the population is around 34 million. The kingdom is third globally in smartphone use, while 72% of the population are active users of social media. Only 2 countries are ahead of us in our speed and in 5G network rollout. All this digital infrastructure and ecosystem will foster growth in sectors across the economy, including definitely healthcare. It's very important to mention that in Kingdom, the healthcare, along with the digitization, are priority areas in our Saudi Vision 2030. All allocated budgets for the healthcare in the year 2020, plus all the added support budgets to react and control the pandemic of COVID-19, plus all the action taken and the changes in policies and procedures and how we were agile in the response to this pandemic. All these things, by that, the government is again demonstrating its commitment and readiness to meet the healthcare needs of the people. In the kingdom, healthcare demand is driven by a growing population that is expected to be more than doubled by 2050, and the 50+ demographic of people who are going to be aging more than 50 years will become nearly 1/3 of all the population in just 10 years from now. Meanwhile, the non-communicable diseases like cancer, diabetes, cardiovascular diseases are on the rise and already responsible for 2/3 of all deaths in our community. And this is going along with the change in the life expectancy as it is increasing, as well as the change in the lifestyle to match more with the civilized and more developed countries' lifestyle. The Saudi Ministry of Health has a plan to meet this demand and address all these challenges. We have set out a series of healthcare priorities. Here in front of you are a list of these ones and list of changes that will take place and initiatives to encounter all of these. challenges. We will not only help to address the burden of diseases, but simultaneously we will improve all aspects of healthcare provision. We also are going to focus on prevention. We are working to leverage our extensive network of primary healthcare centers, which is the first line and a very important line of delivering healthcare and improving healthcare, while expanding at the same time the capacity in the hospitals and specialized medical centers and services. There are multiple initiatives also to improve the efficiency, to improve the digital services usage, and to help to achieve these goals. We are looking to softwares, mobile apps, and digitization as key enablers to support all these initiatives going to be on the way. The ministry is already implementing effective and impactful softwares and digital solutions to help move us forward. And I will be happy to invite and introduce to you Engineer Mona Sbe'i. She is one of the leaders who are participating effectively and actively in implementing and leading lots of these activities and projects and solutions in the kingdom. She will share with me part of this presentation, and she will be honored to present to all of you examples of what digital solutions and these solutions we are conducting and doing in the Ministry of Health and in the kingdom in general related to healthcare. So she will join now in presenting. Engineer Mona.
Thank you, Dr. Mohamad. I would like to welcome all of you to this presentation. As what Dr. Mohamad mentioned, Saudi Ministry of Health has implementing multiple digital solutions and services as a part of the digital transformation journey. Today, I will walk you through some of these key initiatives. For example, Maw'id is a top-rated and widely downloaded appointment scheduling mobile app which links citizens and residents to doctors at more than 2,800 ministry healthcare facilities, from primary healthcare centers to tertiary specialty hospitals. In its first 2 years, 56 million appointments were booked by more than 13 million registered patients. The other two apps are Sahhati and Sahha, which represents these two apps represent our telemedicine present and future. Over the past 6 months, it has facilitated nearly 1 million virtual consultations, filling a vital gap for care in midst of the pandemic. By the end of the next year, we expect Sahhati-enabled virtual appointments to reach 15% of all hospital, outpatient, and primary healthcare centers visits. That is set to reach 40% by 2023. This app enhanced patient care pathway is further complemented by Wasfati app, which provides an e-prescription services. Complementing this patient-facing mobile app is deeper structural change, including kingdom-wide centralized electronic medical record system, cloud-based with servers located inside Saudi Arabia. The system will cover all ministry facilities. Not only is this bringing patient care and record keeping into the 21st century, it also is rolling out unified patient treatment pathways and centralized and standardized the care. This means that our patients, wherever they access our services across kingdom, are getting the same evidence-based approach. To help to ensure this delivery of consistent, high-quality care, we have implemented 2 additional technology-enabled initiatives. The ADAء program helps the ministry to monitor an evolving set of key clinical and operational performance indicators. The program by end of 2021, it will cover all our hospitals and primary healthcare centers. It seeks to use technology, digitization, and the lean concept of continuous improvement to drive out inefficiencies, lower cost, and improve care. One early outcome is achieving an 85% success rate in treating emergency department patients within 4 hours. Another important project is the establishment of National Health Command Center, part of the Kingdom's battle with MERS. The center was already up and running when COVID-19 hit, allowing us to seamlessly leverage it as the nerve center of our COVID-19 response. The center provides a kingdom-wide view of day-to-day operations across our facilities, allowing us aggregate and analyze data to get an early view of emerging health trends and crises. That way, we are better positioned to allocate resources where they are needed most. As a result of our extensive digital health infrastructure and our ongoing efforts to enhance quality of care, we are better positioned than many other countries to respond to COVID-19 pandemic. Saudi Arabia was ranked as 13th safest country globally with regards to the pandemic. We have one of the fastest PCR test turnaround times of any G20 country. Typically, results are available in 8 to 12 hours. Those outcomes, however, were not only achieved because of the digital infrastructure in place when the pandemic first emerged. In the weeks and months since, we developed a number of new apps and digital platforms to address the crisis. And we turned to our existing Maw'id and Sahati apps to provide a new additional services. Some of these apps include Hisn, a public health dashboard that helps ministry to understand the current state of the population health. Taqassi is a COVID patient tracing and tracking platform. When downloaded by citizens and residents to their smartphones, the Taba'ud app alerts users of possible contact with COVID positive individuals. Tatamman app helps the ministry to manage confirmed cases, suspected cases, arrival from abroad, and contacts of confirmed cases. The Tawakkalna app provides a platform to manage approval of movement during quarantine and lockdown period. Our success with digital health services, both before COVID-19 and during the pandemic, has reinforced our roadmap toward extended digitalization. A major component will be toward virtual healthcare. We already offer teleconsultation through Sahati, but we are moving ahead to bring additional virtual services to ensure patient access world-class care wherever they are located and at any time. This will include virtual clinics, telecardiology, teleradiology, tele-ICU, telepathology, teletrauma, and telestroke. It will include non-patient applications such as telemedical education. Again, using technology technology to bridge the vast distance in the kingdom. More broadly, we are taking the National Health Command Center model and launching regional command centers that will focus on monitoring data and delivering insights and information to specific regions. This will bring greater granularity to resource allocation and decision-making, with ultimate goal being better care and improve patient experience. Building on our excellent experience with mobile apps, one of the most important shifts we will make will enhance and simplify the patient experience. These apps have performed superbly, but we know patients would benefit if we were to fold these separate apps and services into a single unified health app. From this one health app, people will be able to access all services I have already mentioned, plus many other yet to come. Designed with the best practice user experience, it will feature standardized workflow for both patient and clinicians and a common look and feel. All ministry clinics, hospitals, and services will be accessible through this one app on people's smartphones. We also are looking to leverage powerful digital technology such as artificial intelligence to improve outcomes. AI can play an important role in supporting clinician decision-making in emergency department prioritization based on analysis from medical imaging scans. And even in more futuristic situations, such as robot-assisted surgery and AI-enabled chatbots for teletriage. We are also implemented home healthcare and self-care tools to provide healthcare services to patients in the convenience of their homes and to empower them in their own care, which also help in limiting infections and reducing healthcare costs. We also know that technology creates platforms that facilitate information exchange. We will leverage this to create Health Creation Hub. This hub will nurture new healthcare ideas by offering technology support and advisory services to startups and other innovators in the kingdom. At this point, it's worth noting that we are not working alone, nor in isolation in the healthcare space. The most existing example of this is NAFIS, National Platform for Health Information Exchange Services. This platform will enable EMR sharing across all healthcare facilities and insurance providers in the kingdom. The system is being developed by the Cooperative Health Insurance Council and National Health Information Center. Comprehensive in scope and reflecting the highest cybersecurity standards, it will link all Ministry of Health facilities, all other government healthcare facilities, including those operated by military and public universities, all private sectors, hospitals and clinics, and all private insurance companies. With that, I will hand it back to Dr. Mohamad Alabdulaali to continue the presentation. Thank you all.
Thank you, Mona, and indeed we're really proud of all these initiatives and all these solutions that represent truly transformative vision for healthcare. Before I conclude, I would like to speak for a few minutes. These are the last minutes of my presentation about the relationship that has positively impacted many elements of the narrative I have just relied. I'm referring to the enduring 80 plus years of friendship between Saudi Arabia and the United States. The United States of America is our second largest trading partner. And today there are countless memorandum of understanding, partnerships, joint ventures, and research initiatives linking our two countries. And as recently as 2017, President Trump and King Salman signed a series of deals with 280 billion US dollars worth in fields such as pharmaceuticals, healthcare, and definitely digital. The impact of this relationship is found in many of the digital healthcare initiatives we have been mentioned today, including Maw'id app, presented by Engineer Muna, ADA platform, the National Health Command Center, and the Ministry of Health initiatives toward having the electronic medical record system. The listed in front of you here are just some of the US companies supporting the healthcare delivery in the kingdom and the initiatives we just mentioned today, as well as some of the Saudi organizations with whom they were partnering. And we are definitely not content to simply celebrate the past and current relationships. Sure, it's clear that Saudi Arabia is on the move, and there are many areas for further collaboration between the two countries. And all these entities and companies and sectors we mentioned already. These include fields such as radiology, electronic medical record, diabetes, and other diseases like obesity, and its control, treatment of many other diseases like heart disease and infectious disease control, and definitely the area of artificial intelligence and other digital solutions. In short, Saudi Arabia offers major opportunities for healthcare investment. This is boosted by a welcoming business environment and regulatory changes that seek a growing role for the private sector, including public-private partnerships. Given my comments today, you will be little surprised to learn that healthcare investment opportunities are particularly promising in the fields of digital healthcare, pharmaceuticals, vaccines, and medical technology manufacturing, healthcare education, training, and medical supplies. Before concluding, this is a short film that will reflect the digital healthcare journey that we are having in the kingdom. It's going to be a short one, where I am inviting you to join.
Saudi Vision 2030 is driving an ambitious and fast-moving transformation in healthcare that puts a focus on patients and world-class care. We have been taking large steps with results that speak for themselves. Amidst the pandemic, our response has been defined by speed and impact, showing that we got the will, infrastructure, and people to deliver a healthy future. But what's next will take partners locally and globally, especially from the United States. Our two nations have been allies for generations, generating benefits for all. In healthcare, this partnership fosters innovation and the sharing of world-leading technologies. The kingdom's ambitious healthcare transformation will succeed, in part by continuing to expand this collaboration. Working together, we are creating opportunities for all and delivering a bright healthcare future for the people of Saudi Arabia. Thank
you very much, Your Excellency. This is like beyond moving. You won't believe the tweets and the chats that are happening while we're listening to you about the incredible work that you should be very proud of in Saudi Arabia.
Thank you. Thank you very much. And if you allow me just to close it,
yes.
I'm really thankful with all these promising and ambitious plans and visions. Definitely, all these would require a strong partners in our journey. And definitely, what we are learning from all this journey between these two countries, definitely the partnership with the US companies is going to be a thing that we will be proud to continue while achieving all these initiatives and goals. Thank you very much.
You're welcome. Thank you very much again. A really great honor, and congratulations on all what you're doing. The mere fact that you were able to open Bayt Allah, Mecca in this COVID pandemic is beyond amazing. That's really what we're very touched by.